what is the effect of having a focus, right? That was our first topic here.
Yes.
What effect does that have on outcome? And it's actually quite significant. So therapists who take some charge of the sessions, actively focusing the patient on their areas of difficulty, on the symptom-generating situations, and in particular, what we would call an internal focus. All too often, therapists sit and listen to patients talk about other people.
Yeah.
Complaining about the boss or their kids or their husband. This doesn't help anybody. So how can we say, I understand that it sounds like your husband has some difficulties with drinking, but my real concern, you're the one who's here to see me, is what are the difficulties you're having in dealing with that? So how we create and then maintain this internal focus and getting agreement on what we are actually here to address has a very significant relationship to outcome. Conversely, those therapies that are unfocused, where people kind of shoot from the hip and go with the flow and so on, actually are associated with negative outcome. So focus on both levels. The more you sustain and agreed upon focus, the better your outcome is likely to be. And a failure to focus will set you up for failure.
Mm-hmm. And when you talk about the internal focus, are you talking not just about the therapist has to stay on point within themselves, but also you're hoping that the client will begin to adapt a similar concern?
Yeah, and it's not really, in a way, about hope. It really is that unless and until the patient sitting in your office can identify a problem that they are having internally, their own conflict, you really can't do therapy. You can't do psychotherapy. You can give advice, you could do problem solving, but psychotherapy, right, is a therapy of the psyche, of the internal world of the patient. How whatever their life circumstances are is actually affecting them internally. What's that stirring up that they are struggling with? Mm-hmm. In a way, unless you develop this agreement that you're there to help this patient with their internal problem, then you as the therapist are in somewhat of a helpless position. Yeah. There's nothing you can really do about the patient's boss or, these external things. So it helps both the patient and the therapist to get clear about the internal nature of the problems to be addressed.
Yeah, I'm thinking of the patient who comes in expecting a magic bullet, and they're not really owning the issues themselves. They're not really struggling. They're, okay, I'm giving this to you.
That's right.
You're the expert. Tell me what to do.